So pneumonia is a technical term which means infection of the lungs. It involves severe inflammation of the soft parts of the lungs where air exchange takes place, and because of inflammation those areas become solidified with inflammatory material. So this is how pneumonia occurs. So pneumonias can be classified technically with by saying that they are bronchopneumonia, which is a different pattern. So there's a spread primarily from the air passages, and patchy involvement is there. Or there may be lobar pneumonia, where an entire area of the lung is involved. So in terms of treatment, there is no change between the two types. What is more important is what is the organism or what is the microbe which is causing the infection. So we can get viral pneumonia, we can get fungal pneumonia, we can get bacterial pneumonia. The bacterial and fungal and viral tend to be the commonest type of pneumonias. So as I just mentioned, the pneumonia is essentially caused by microbes. So they can be bacteria, which is the most common, or viral, which is also fairly common, or rarely it can be caused by a fungus. So pneumonia, since it involves the lungs, there are some general symptoms and there are lung specific symptoms. So general symptoms are fever, not feeling well, body ache. These are the general symptoms. As far as lungs are concerned, so patient would have cough, maybe producing some phlegm by coughing out some material. Often they would be breathless, and if there is a largish pneumonia which is involving the outer lining of the lungs, then what we call pleura, and they can also get chest pain. These are the commonest symptoms. Occasionally patients may present by coughing out some amount of blood as well. So that depends on what is causing pneumonia. So most of the time we would treat with antibiotics. Only if we find that the cause is, say, fungus or a virus, then the treatment is given for them. For example, even COVID, the serious patients had COVID pneumonia, so the specific treatments was initiated accordingly. Then in the flu season, we see quite a few patients with influenza pneumonia, which again needs specific treatment. The bacterial pneumonias, then depending on what particular bug is involved, we need to treat with antibiotics accordingly. A community-acquired pneumonia with somebody who is healthy and is coming from his home with a pneumonia is usually with less virulent organisms, whereas a person who is already has some underlying lung disease or is immunocompromised, such as is diabetic or is on long-term steroids or is on some medications which decrease the immunity, for instance, for certain kind of joint pains, rheumatological conditions, etc., or somebody on cancer chemotherapy, they tend to have more severe, more virulent kind of organisms causing the infection. So treatment depends on what are the likely organisms which are causing this. We start with a broader spectrum of antibiotics, and once we have culture reports or laboratory results which tell us what organism is producing this infection and what is their sensitivity to antibiotics or resistance to antibiotics, then we can modify the medications.